Well, this is a very interesting case. To start the case, I would like you to see this video first and then try to formulate or try to make your own opinion.
रात में निकली गाड़ी दी
This is 1.5 months old baby who was brought to the casualty of Baba Saheb Ambedkar Hospital on 14th of February. When the child came to us, this child was brought in the having active seizures. When the child was seen, this child was having active seizures. Child was having no bleeding manifestations outside. Examination revealed this child had a bulging fontanelle. This child was having a shrill cry. You will watch in the video that this child is having increased tone also. So the child was posturing. So going further into it, the child only had fever for a day. That was also very low grade fever, and there was history of the decreased feeding only for a day. But yes, it was this child was a product of a full term vaginal delivery, born in some nursing home, private nursing home. The history of having received some vaccination or injection is not very clear. Now when the child came to us, as I said, we further asked the dietary history. This was an exclusively breastfed baby. So 1.5 month old baby, exclusively breastfed, coming with 1 day history of fever with bulging fontanelle and posturing. So what will you like to keep in mind, Divanshi?
Sir, vitamin K deficiency.
Straight away. Because I told you earlier. No. That is, I asked you the question.
Sepsis is a more common.
Yeah, that's right. Common things common. Don't forget the common things. Whatever video is being shown to you, just stay on the ground and always talk of the sepsis. This is a child had short, low grade fever for a day, right? Bulging fontanelle. So keep in mind meningitis. So this was precisely this you must keep in mind. So when the child came to us, we examined this child. The child had normal vitals. The heart rate was about 130, respiratory rate was about 48, SpO2 was 98. Now this child had seizures, and if you record any child coming with seizures, you have to find out about the blood sugar level. This child was euglycemic. It was done. So euglycemic, the capillary filling time was also less than 3 seconds. So child was not having any shock. Yes, one noticeable thing was this child was looking pale. This child was also looking quite pale for 1.5 months old. If you can recall in the video, the pallor is there. Now, we did the CNS examination, and CNS examination has told the child was having the bulging fontanelle, and the tone was increased in all the 4 limbs. Pupils were normal, but they were mildly dilated and they were sluggishly reacting, both the pupils. Further examination reveals the abdomen was normal, the other systems were all normal. So all those things, as I was asking Divyanshi, now with all these things in mind, a possibility of meningitis was kept. And then what did we do in the emergency? We controlled the seizures by giving anticonvulsants. And then we did the CBC and then the LP. CBC we got it first, and CBC the platelet count was normal. Since the child had a bulging fontanelle, I think Archana was on duty, yes, and the LP was done, and LP came out to be hemorrhagic. First, anybody would think that maybe it is a traumatic LP, but then she did it at the other site also, and this LP, it was uniformly hemorrhagic. So what good thing she did was, she did a 3-tube test. So 3-tube test, it was uniformly hemorrhagic. May I ask Vishal, why this 3-tube test is done? No idea. Puneet.
Sir, to see if the blood is clotting.
Blood is clotting.
Blood.
It is not like that. It is that if it is a traumatic LP and you do the 3 tubes, what happens is usually the blood clears. So it's a traumatic LP, it becomes little clearer. So you do the 3 tubes, and if it is uniformly hemorrhagic, it's a very crude test, but it's a very good bedside clinical test that it was uniformly hemorrhagic. So that is suggestive of a subarachnoid hemorrhage. So this child had a bulging fontanelle. LP had revealed a uniformly hemorrhagic fluid. So keeping those things in mind, so this was a query subarachnoid hemorrhage. So now having said that, with all the history earlier which I said, exclusively bedfed baby, doing well, having intraventricular query, intraventricular hemorrhage, subarachnoid hemorrhage, a possibility of vitamin K deficiency bleeding was entertained. Now for that we investigated the child. The prothrombin time of this child, let me read it. The prothrombin time of this child was 25 seconds and the control was 14 seconds. The APTT, activated partial thromboplastin time, was, the control was 36 seconds, and this child had 77 seconds the APTT. Now you have a child who has got increased PT, increased APTT and normal thrombocyte count. Hemoglobin of this child was about, at that time, was 11.2. So a child who is as I said, the child is looking pale because 11.2 for a 1.5 months old baby is also pale. So the DLC was okay, and the platelet count at that time was about 5.2 lakhs. So I would like to keep in mind, as Divyanshi said, this is a child who is 1.5 months of age and has come to us with hemorrhage, most likely intraventricular hemorrhage. So what possibility you said, what is the exact diagnosis?
So late onset.
VKDB is a broad term.
Late onset. Vitamin.
Sorry?
Late onset vitamin K.
So could you define what are the various types of hemorrhagic disease?
So there's within 20.
इसको वो दे दो.
So within 24 hours.
Okay.
Within 24 hours, 2 to 7 days, and then beyond that, mostly within 1 to 3 months.
Okay. So first is early.
Yes, sir.
What are the causes of early hemorrhagic disease?
So that's usually because of maternal drugs like phenitoin or
Very good,
warfarin,
very
which
good.
causes reduced inhibition of vitamin
the
K.
child is, mother is receiving some anticonvulsants.
Yes.
Mother is receiving some vitamin K deficient, warfarin like
Warfarin,
drugs.
yes.
For some, one is that. And then is the classical. Classical
Yes.
starts from 1 day.
Two-
I thought it's 3 days or 1 day.
2 to 7 days.
I think it's 3 days.
I'll check
Sir,
this.
would you like to say? The classical is 3 days to 7 days. Anyway, you can check your books. I feel it is still 3 days. It is early. From 3 days to 7 days is classical, which we see. I happen to see, I recall my memory, children had come to us bleeding. I still remember one of my doctor's friend, whose brother's son, child, they were in a the child came in on the 3rd or 4th day with bleeding. And this child was doing very well. There was no history of having received any vaccine. Common things common, you always keep sepsis in mind. But this child had vitamin K deficiency. So one is that, and this is, as you rightly said, this could be a late hemorrhagic disease of infancy. Now in late hemorrhagic disease of infancy, what we did was, you can come closer and you can see, as I said, the bleeding, we got the NCCT done for this child. So this is a very interesting CT which I like to discuss. आप ये इसको थोड़ा focus करो. See this. आप इसमें देखेंगे, what are you seeing? You seeing the communicating hydrocephalus. These are the lateral ventricles. These are the frontal horns, and these are the. See these, all the horns are dilated, even the occipital horns. See these, and then you find this is the 3rd ventricle which is so much dilated, and see this 4th ventricle. 4th ventricle is dilated. So this child has got communicating hydrocephalus, and so much so that from the ventricular hemorrhage it would have gone into the subarachnoid spaces, and for which the LP was done, and in the intraventricular you got the hemorrhagic CSF. What else is very important here is you find hyperdense areas here. Can you see it? बोलो भैया, दिवांशी आगे आके देखो.
Yes, sir.
ये देखिए, ये इसको these are the occipital horns, and in these occipital horns you find hyperdense areas. So if you find hyperdense areas in the NCT, this is suggestive of acute hemorrhage. So this is intraventricular hemorrhages. Not only that, this child has got intraparenchymal hemorrhages also. See this? See this? Hyperdense areas. So this has got, unfortunately this child was quite sick. So intraparenchymal hemorrhages, intraventricular hemorrhages, so much so that there is a communicating hydrocephalus. That means the subarachnoid spaces would have got blocked. That is what is the cause of the communicating hydrocephalus. So this is what is this CT shows. So it is proven that, keeping in mind this child, what we did the, how will you treat the Tanu? Okay, vitamin K दे दिया, वो हमने दे दिया. अगर इतना बच्चा सिक है तो और कुछ दे सकते हैं? We will give FFP. FFP भी दिया हमने इसको. So we gave FFP to this child to give immediately the clotting factors. What are the vitamin K dependent factors? Oh, Rao, where are you? Huh? So vitamin K dependent factors. Tell me, what are the vitamin K dependent factors? It's a PG class, you see.
Factor 2, 7, 9, 10.
Which one? 2, 7, 9, 10. Very good. So 2, 7, 9, 10, these are the vitamin K dependent factors. And what is happening is the factor 2, 7 and 9. 9, 10. 10 is the common pathway factor. So what happens is the 7 is the extrinsic factor. Okay. So 2, 7, 9, 10. So 2 will be coming here. That is the prothrombin to thrombin. So you have the common pathways, you have the extrinsic pathways, and you have the APTT. So if you have the intrinsic pathway, APTT increased, PT is increased, and normal thrombocyte count, this is very suggestive of the vitamin K deficiency bleeding. Now what is happening is, when you have the vitamin K deficiency, what is happening? It acts as a cofactor. Now there is another confirmatory test which is called PIVKA, protein induced vitamin K absence. They are basically proteins which are there in the blood, which you measure, and more is the value of the PIVKA, the more severe is the vitamin K deficiency, because it basically causes, I think, carboxylation, if I am correct.
Gamma
so if it cannot there is no carboxylation. Yeah, please tell me.
Gamma carboxylation.
One of the clotting factors. Vitamin K does the gamma carboxylation of these 2, 7, 9, 10 factors.
Very good.
So this and this agent.
So if it is not, vitamin K is not there, those proteins will not get carboxylized. So they will be all there in the blood. The more is the value, the more severe is the disease. That is how. But PIVKA is a test which we used to do under the research projects. So it is very good that you must know that if you have got these findings, PT, APTT increased, normal prothrombin time, but unfortunately this child was very sick. So this child we could not save. Even though we gave FFP 2-3 times and the bulging Fontanelle, which you have noticed in the video. So this is what I wanted to apprise you all people, that this is how sometimes the children come. And this is also mentioned that hemorrhagic disease of infancy, most of the time the presentation is intraventricular hemorrhage. So there is always a controversy. I see two of my great neonatologists sitting here, Dr. Kaushal and Dr. Vikas. There is always a controversy. I still remember there was an article in 1997 about in Indian pediatrics whether to give vitamin K to all newborns or not to give all newborns. But I personally feel that it should be given, because even if you save one child, that is why vitamin K should ideally be given. And I think in most of, what would you like to say, sir?
We are giving to 100%. इसमें से normally categorization.
आप दीजिएगा उनको.
Normally, children with vitamin K deficiency, if we classify them, they are well-looking children.
Yeah.
And because there was CNS involvement in this, that's why this child was sick-looking.
Yeah, that's right.
Otherwise, classify sick-looking, well-looking. This vitamin K deficiency comes under well-looking child. They bleed, but they are otherwise okay.
Normal. Yeah.
And regarding PIVKA, I would say, sir, rather than doing PIVKA, it's a very cheap version. Give vitamin K if it responds well. Until unless it's an emergency, then FFP is the answer.
Very right. I also always ask a question: if you give vitamin K, in how much time it improves? It starts improving very fast. Within few hours only. Within, I think, an hour or so. maybe in 30 minutes, this child starts responding. So vitamin K response is very fast, and this is the response to the vitamin K. Yes, you are right. PIVKA, that is why it is not very popular. But if somebody asks in the MCQ or for the postgraduate, what is the best confirmatory test, that will be PIVKA. Any questions anybody wants to ask? Now talking about something about the vitamins, you were talking with Dr. Vikas. Minadion is one drug which is given. That is what is there in my hand. So you give 5 milligram IV. So it's a water soluble vitamin. So you have vitamin K1, K2, K3, and I think this is K3. This is synthetic. That is vitamin K3. So K3 is the Minadion which we normally give. That's all. So you must keep in mind these children do come, and this is a very important case scenario which I thought I will discuss with you. Thank you very much.
इंडिया में इंसिडेंट अच्छा खासा आई है।
अच्छा, मुझे अभी तक याद आ रहा है, अभी बंद कर दिया ना भैया।